CNA Skills Audiobook. Chapter: Foundations of Nursing Assistant Practice. Introduction. This chapter introduces the foundational knowledge and skills required of a certified nursing assistant. These areas form the backbone of safe, ethical, and compassionate care. Understanding these concepts prepares learners not only for certification exams, but also for real-world responsibilities in healthcare settings. Activities of daily living. Activities of daily living, commonly known as ADLs, are the routine tasks individuals perform to care for themselves. These include bathing, dressing, grooming, toileting, eating, and moving from one place or position to another. When a person becomes ill, injured, or experiences age-related limitations, assistance with these tasks may be necessary. Supporting daily activities helps maintain comfort, hygiene, and dignity. Encouraging participation in these activities helps preserve muscle strength, independence, confidence, and emotional well-being. Observation during daily care also provides important insight into physical or emotional changes. Aging process. Aging is a natural and continuous process that affects every system of the body. While aging brings predictable changes, it does not automatically mean illness or disability. Physical changes may include reduced muscle strength, slower reflexes, sensory decline, and fragile skin. Emotional and cognitive changes may include slower processing of information, increased need for reassurance, and vulnerability to loneliness or depression. Understanding normal aging helps distinguish expected changes from signs of disease. Respectful, patient-centered care supports independence, safety, and quality of life for older adults. Anatomy and physiology. Anatomy is the study of the body's structures, while physiology explains how those structures function together to maintain life. The body operates through interconnected systems, including the circulatory, respiratory, digestive, nervous, musculoskeletal, urinary, and integumentary systems. Knowledge of these systems allows caregivers to recognize abnormal signs, understand the effects of illness, and provide safe, informed care. Body mechanics. Body mechanics refers to the safe and efficient use of the body during movement, lifting, and positioning. Proper body mechanics reduce strain and prevent injury, especially to the back. Using a stable stance, bending at the knees, keeping loads close, avoiding twisting motions, and using assistive devices all contribute to safer movement. Consistent use of proper body mechanics protects both the caregiver and the person receiving care. Client rights. Client rights protect individuals receiving care and ensure they are treated with dignity and respect. These rights include privacy, confidentiality, informed consent, the right to refuse care, and participation in healthcare decisions. Respecting these rights builds trust and supports ethical practice. Violations can lead to legal consequences and loss of professional credentials. Communication. Communication is essential in healthcare and occurs through verbal, nonverbal, written, and electronic forms. Clear communication promotes safety, understanding, and cooperation. Listening attentively, observing body language, speaking respectfully, and reporting information accurately help prevent misunderstandings and medical errors. Effective communication supports emotional comfort and quality care. Please subscribe to Easy Life Studio for more helpful content like this. Cultural and spiritual needs. Cultural background and spiritual beliefs influence how individuals view health, illness, food, personal space, and care practices. Respecting these beliefs promotes comfort, trust, and cooperation. Providing individualized care requires openness, respect, and willingness to ask questions rather than making assumptions. Cultural sensitivity improves outcomes and strengthens the caregiver-client relationship. Data collection. Data collection involves observing, measuring, and reporting information related to a person's condition. This includes vital signs, intake and output, skin condition, pain, and behavior changes. Objective data is measurable, such as temperature or pulse. Subjective data includes information reported by the individual, such as pain or nausea. Accurate data collection and timely reporting support effective clinical decision-making. Ethics and legal issues. Ethics guide moral behavior in healthcare. Ethical principles include acting in the client's best interest, avoiding harm, respecting choices, maintaining fairness, and honoring commitments. Legal responsibilities include following care plans, reporting abuse or neglect, maintaining confidentiality, and working within defined roles. Performing only authorized tasks protects safety and professional integrity. Infection control. Infection control prevents the spread of disease and protects both clients and caregivers. Key practices include proper hand hygiene, use of personal protective equipment, cleaning and disinfecting equipment, and following isolation precautions. Understanding the chain of infection helps identify how diseases spread and how breaking any link can prevent transmission. Medical terminology. Medical terminology provides a standardized language for healthcare communication. Most medical terms are formed from prefixes, root words, and suffixes. Understanding these components improves accuracy, reduces errors, and enhances communication among healthcare team members. Mental health. Mental health affects emotions, thinking, and behavior. Conditions such as depression, anxiety, dementia, and Alzheimer's disease are common in healthcare settings. Providing calm, supportive care, and observing behavioral changes are essential. Changes in mood or behavior may signal medical or emotional concerns that require reporting. Nutrition. Nutrition provides energy, supports healing, and maintains overall health. Assistance may include feeding, monitoring intake, and preventing choking. Special diets, such as diabetic or low-sodium diets, are prescribed to manage medical conditions. Following dietary instructions is essential for safety and recovery. Personal care. Personal care includes hygiene activities such as bathing, oral care, hair care, nail care, and perineal care. Proper hygiene prevents infection, promotes comfort, and preserves dignity. Privacy, respect, and safety are essential during all personal care activities. Range of motion. Range of motion exercises help maintain joint flexibility and muscle strength. These exercises may be active, passive, or assisted. Regular movement prevents stiffness, contractures, and circulation problems. Exercises are performed gently and never forced. Role and responsibility of the CNA. The nursing assistant works under the supervision of licensed nurses and plays a vital role in daily care. Responsibilities include providing basic care, observing changes, reporting information, following care plans, and maintaining professionalism. Nursing assistants are essential members of the healthcare team. Safety. Safety practices protect clients, staff, and visitors. These include fall prevention, fire safety, safe equipment use, and emergency preparedness. Reporting hazards promptly prevents accidents and injuries. Vital signs and testing. Vital signs measure basic body functions, including temperature, pulse, respiration, blood pressure, oxygen saturation, and pain. Accurate measurement and timely reporting of abnormal results are critical for early detection of health problems and emergencies. Chapter conclusion. These foundational skills and concepts define safe, ethical, and compassionate nursing assistant practice. Understanding and applying them consistently supports high-quality care, professional growth, and successful certification. Headphones CNA Skills Audiobook. Chapter: Essential Hands-on Care Skills. Introduction. This chapter focuses on essential hands-on skills that are core to daily nursing assistant practice. These skills protect patient safety, promote comfort and dignity, and reduce the risk of injury and infection. Providing catheter care. Catheter care involves the cleaning, maintenance, and observation of a urinary catheter. A urinary catheter is a tube placed into the bladder to allow urine to drain when a person cannot urinate normally. Proper catheter care is essential for preventing urinary tract infections. Cleaning is performed at least once daily and after bowel movements. The area where the catheter enters the body is cleaned gently, moving from the cleanest area outward. The drainage bag is kept below bladder level and never touches the floor. Urine is observed for color, clarity, odor, and amount, with abnormalities reported immediately. Taking vital signs. Vital signs reflect how well the body is functioning and include temperature, pulse, respiration, blood pressure, oxygen saturation, and pain level. Accuracy and timely reporting are critical, as abnormal readings may indicate medical emergencies. Making an occupied bed. An occupied bed is made while the individual remains in bed. Linens are changed one side at a time to maintain comfort, warmth, and dignity while preventing skin breakdown. Partial bed bath. A partial bed bath cleans selected areas of the body using warm water and gentle soap. Care is taken to dry each area thoroughly and protect privacy throughout the process. Gait belt transfer. A gait belt provides support during standing, walking, or transferring. It improves stability and reduces fall risk when used with proper body mechanics. Dental care. Dental care promotes comfort, nutrition, and infection prevention. The mouth is cleaned gently and observed for signs of irritation or infection. Positions. Proper positioning supports breathing, circulation, comfort, and skin integrity. Repositioning is done regularly for individuals unable to move independently. Transferring a patient. Safe transfers require preparation, communication, proper body mechanics, and controlled movements to prevent injury and fear. Chapter conclusion. These hands-on skills form the foundation of safe, compassionate, and effective nursing assistant care. Please subscribe to Easy Life Studio for more helpful content like this.